it's my pleasure to introduce to you my colleague Nurit Glaser from Israel. Nurit is a social worker, she's a therapist, she facilitates group therapies, and recently she earned her PhD from Bar-Ilan University. So congratulations, Nurit. And she did her research with Dr. Nechami Baum. And today, Nurit will present her work about fathers who lost their babies to stillbirth. We thought that all other presentation and the focus so far was especially on the mothers, and we had some mentioning from Australia about the role of fathers, and we heard a little bit about the fathers in the UK, but now we thought that, it's time that we shed light on the experience of fathers who lost their babies. So, Nurit, thank you so much, and we are here to hear you, so good luck.
First of all, thank you for inviting me. I actually have a recorded lecture, so we will watch her and then we will have a Q&A, I guess. Hi, my name is Dr. Nurit Chodik. I'm a social worker from Israel. Thank you for the opportunity to share my work in this very interesting webinar. I will be touching the breastfeeding and its therapeutic effects in recovery later on. My research focused on the experience of men after stillbirth. I will start with the definition of stillbirth. Stillbirth defined as a birth of a lifeless fetus after 20 weeks of pregnancy, some places 22 weeks. But the emotional one is more complicated. Stillbirth is an extremely unsettling experience in which death precedes the beginning of life. What should have been a joyful event become tragic, and happiness and rewards are replaced by severe loss and pain. Here's a visualization of how frequently men mentioned in the previous research. We analyzed 150 abstracts on papers dealing with stillbirth, published between 1965 to 2019. Those are the results. It's very easy to see how marginalized fathers are in this content. You can easily see the mothers here, woman, and it's very hard to find the fathers in this picture and in research. For an example, a paper from 2008 that deals with stillbirth as a socio-political issue never allow the men are part of the stillbirth experience. Never once do they use the word father. On the other hand, mother, a variation of the word, is mentioned 29 times. When a father is looking for something theoretical after something like this happened to him, he can't find himself, literally. Amazingly, men respond to the invitation to be a part of the research in only 48 hours. I had 2 days it took to 30 men to ask to be a part of this research, which tells us a lot of the need that they felt to be a part of something and to tell their story. I interviewed 30 men in the ages between 29 to 55 in a different range time since the loss, from 3 weeks to 22 years. Some of the things they told me after the interview. I can tell you that this is without a doubt the longest, most extensive conversation I have ever had on this subject. Or another one, I don't think I've ever told this in this way to anyone. I don't know if it's something I would have done if it wasn't the research. And not only the two of them, most of the people that I interviewed told me that this is the first time for them to tell their story. It's the first time that somebody is asking them to tell the things they had and felt from their point of view. In addition to the complicated grief feelings, the main issue was the striking gap between their intense personal feelings and the low levels of awareness among those around them. They felt pain and despair, they felt guilt and profound grief, and no one sees them. They felt lonely, they felt like the stillbirth is a life-changing experience that influenced in a dramatic way and had dramatic impact on relationship, and nobody sees them. Nobody acknowledged that this would happen to them. An example for the lack of family support. I so wanted my parents to feel it was their grandchild, but they weren't able to feel that or to treat him like their grandson. let them feel that they lost a grandson, that the date will be a memorial date for them. Where are they? How come they never came visit? You know what? Just acknowledge, that's all. He wanted them to put a picture of the dead baby between all the other grandsons, and they couldn't do it. And he felt that they ignore him, but they felt it's too much for them, and it was painful for everyone. Another example for the lack of support. They all had only the best intention, but the resulting lack of trust toward their families is something we carry around with us to this day, and it's had serious effects for our lives as a young couple. In short, we are scarred. And listen to the word he chose to use. Many of them felt very lonely, and it came again and again in all kinds of interviews. One of the hardest things is that you're alone. You're really, really alone. Nobody is entering and asking how they are. They're very, very deep despondence. There was just no one to talk to. There just wasn't. One of the reasons, or some of the reasons, that it's very, very complicated to acknowledge the ways that is the social expectation from men. The society expects from men, even today in 2021, to be physically and mentally resilient, to get over it, to be restrained, to be rational, to be strong for the family. And they sometimes they can't find themselves in those expectations because they don't feel exactly like what the society expects from them. Almost all fathers mention that they were told again and again to support their partners. Here's an example for this. Everyone said I needed to take care of her, that she was the one going through the crisis. I was kind of pushed aside. People would take me aside and say, you have to take care of her now. And I didn't know. I didn't know what to do, just as she herself didn't know what to do. Well, this shocking loss is very surprisingly come for both of the couple, for the woman and for the man. And both of them don't know what to do. In summary, men just don't feel important enough. There is a tendency to share with the man, not to share with the man what's happening. He's talking about the hospital. They'll take your phone number, but no one will call. Okay, I get it. We aren't important enough. It's like last kid no one wants to play with. That's the feeling. It's annoying, it's hurtful, and it's insulting. The lower awareness to men's grief can be explained by many ways men cope with the loss. Caregivers should pay attention to those behaviors. We can see here some behaviors that usually we won't feel that they are exactly express grief. But in men, sometimes though that's the way, like long late hours, shopping gadgets, excitement, risk-taking, going drinking, or using black humor or sarcasm. So we need to look different in a different way. This triangle of profound grief, lack of recognition, and the expected supporting role result in the paradox of disenfranchised grief, and therefore a more intense and long-lasting grief. Actually, social support is lacking and the feeling of grief increasing. So you see the paradox here. Just to summarize this, is the emotional process that build up the eventually might lead to the delayed grief of even to a crisis. We can see here lack of social legitimacy to grief that can lead to lack of social and family support, that can lead to all kinds of different reactions like anger, rage, aggression, difficulty sleeping, somatic symptoms that can lead to reinforced behaviors like long work hours, addictions, or shopping, and sometimes, in many times, can lead to delayed grief or a really serious crisis. In the words of Carol Gilligan, that was a researcher of gender, we can maybe have some a little more space or freedom. Men are expected to be rational and women sentimental, which limits both men and women. Since paradoxically, both men feel and women think. So the whole paradigm needs to change. Maybe if we will look differently on men and women, they will have more freedom to express themselves any way they want. So how to take care for men after the loss? We actually have to be first of all, we have to recognize, we have to acknowledge the loss and understand it. We have to acknowledge the loss is for both parents and not only for the mother. Second, we have to be aware of the ways in which men can express or deal with the loss. And sometimes it's different from what we are looking for. We have to be flexible and allow continuity, and response is normal. And we have to be creative. We have to develop appropriate interventions for men. I have an example for that, to something we actually did for the first time in Israel, and I think it's maybe the first time in the world. We did a workshop of 2 days in the Dead Sea, and we took 9 men after stillbirth for 32 hours of conversation, of partnership and activity. We actually, they told us this is the way they want to talk, and they came for 2 days and then they go home. It's not something that have a continuity for a long, I don't know, for a year, or you have to come every week or something like that. It was geographical distance from their houses. It was a gender sensitive group, only men. We talked in the room and we were outside. We were in the nature and in the air condition. Some of the things they told at the end. It strengthened me to know that I was not alone. Remember the things we said before. I got some air here and it was necessary. I need to think about how to take care of myself. I take with me from here the ability to cope, the connection to emotion. Some more things. I choose life. I choose action. It was an intense and meaningful experience. I take with me the closeness. The workshop was exciting and I understand all sorts of things I did not understand before. And here we come for today's webinar's topic. Surprisingly, the issue of breastfeeding appears only in 1 of 30 interviews. It was mentioned in a negative way. Breast milk was mentioned as a painful reminder of the loss. It was therefore very sensitive to me that both parents wanted it to dry up quickly. Today's discussion shed light on the different aspects of breast milk and its therapeutic effects in recovery after the trauma of stillbirth. But when I came to think of it during the preparation of this webinar, breastfeeding and the production of milk may be understood as a healthy and natural physiological process that can also symbolize life, vitality, and recovery from both parents. This very emotional process can make the partner, the male partner, more involved during the very challenging days after the loss. Thank you.
Thank you so much. Do we have some questions here? I just need to pull up things. I was paying attention to the discussion, so to your recording so much. It was wonderful for you to do that, and I'm very glad you ended with thinking about breastfeeding. Nurit, can I ask, do you think this might go back to part of what Nick Embleton was asking before about gestational age? Could it possibly be that some of these things were related to do you know how many people went through lactation issues, even though it only came up with one person?
Well, most of them didn't talk about it. And actually the protocol in Israel is that nobody asked them they can't choose about it. I mean, the first thing they've been told in the hospital is to dry up the milk. So it's not even an option to do something else. I don't think any of the hospitals in Israel is thinking in this way. So maybe, I mean, we have to start in the very beginning to maybe to understand the therapeutic effects of that, and then to ask and explain, because the milk is really a painful thing. I mean, it's a reminder for something I can't do anything with it, and they get the pill and just dry it, and it have no other meaning yet. And I think in other places, like I hear today and like I read before, it's very, I mean, it's so different, and it's the conversation is it's pro doing it. And I think Israel needs to start from the beginning. I mean, we need to go and explain the meaning of it, and just try to not to convince, only to that people will understand that there is an effect for that, because nobody is talking like that.
Yeah. And I think that's an important point that we need to remember as well. The other, when you were talking as well, I was thinking of two things historically and cross-culturally. I was thinking about some work that I'd seen from Brazil, where they had done, a colleague there did her PhD on with families experiencing grief and thinking about donation, and it was not something that was actively available either. And the main intervention was to dry up the milk with medication. And so but when the families were approached, some, not all, said we wished we had had that opportunity, and that was both fathers and mothers. So I think it's wonderful.
And I really think, as Dr. Debbie Nubelkar, that she said before, she said really thinks exactly what fathers could do. I mean, they could be meaningful and to do something to be less helpless. And exactly the things she said about the fathers, exactly the things that father could do at those days that they didn't know what to do. And maybe if they could, they will have something, a mission. It will look differently, because those days are very critical for afterwards. Even, I mean, not the days afterwards. It's very critical for months and years afterwards. And I think this can be really, really different for them.
It's one of the things coming out of the pandemic as well, because some of the work that we're doing right now in Ireland are with parents who had children during the pandemic. And so the units and care providers recognizing families as opposed to just mothers and infants or just mothers, and especially when bereavement occurs, that in the many of the healthcare providers that are with us today would recognize, and the components of family-centered care, nurtured care, what the WHO is calling, but this could be part of that. So,
right.
Tanya,
yeah.
I'm just thinking there's been a question from Naomi Baryam about whether the work is going to be, that Nurit has done, is going to be expanded. And I also wanted to ask
I didn't see that question. So sorry, I'm glad you caught it.
That's okay. And also I wanted to ask another question about Israel is such a melting pot. You know, there are so many cultures and so many peoples from all over the world who live in Israel, and we also have different, I guess, religious connotations as well. So I wondered if the research covered a wide variety of men, or was it mainly kind of non-religious Israeli-born men, if you like? It's hard.
Yeah,
I can't think how to word it.
I understand exactly what you're asking. I mean, my research include only Jewish men, Hebrew speakers, and I mean, it's not only about interviewing only Hebrew speakers men. I mean, it was different cultures have different religious and different things they believe about the babies, and the differences are very, very big. So we need to understand it before, and because it's really one of the first research that ever in Israel, but there is really little research on men. We need to start from the beginning, exactly like I said before about other things. I mean, and we do want to do another research on Arabic men, and it's going to be totally different from all kinds of reasons. Not only the beliefs about the baby and religion. I mean, it's only about culture and gender and all kinds of different things of families. I mean, the families is practically is differently. So hopefully we will do more research on other cultures in Israel.
Yeah. I want to add something, if I can, about to put things also in a context of the milk bank. So we have only one milk bank in Israel that it's fairly new. We just it was just opened in 2019 in August. And it's not open and it's not accessible for everybody. So it's not just changing the discourse within the society about donating milk while grieving or approaching fathers, but it's also like, you know, even if she wants to say to her doctor, you know, I refuse to take the pill, what she can do with the milk. And I think from our perspective, the Israeli perspective, I think the work that Debbie Nobler Care doing in Australia is extremely important, because I think we first need to approach hospital staff and approach, you know, the first people that are meeting the families right after the loss. Also, we have what I mentioned when we had the conversation from Vietnam. The notion about the evil eye is something that I keep hearing, that, like, you know, we don't want to have this kind of milk mixed with other milk. So it's also questions that we need to take in mind. And I think, but in general, that fathers need to be included. And like I found also in my previous research, like it's a main, and it's also promoting not just the father's health and the mother's, but also the not just the family unit, but the relationship is really much improving, and it's something that we really need to advocate for. So thank you.
Can I ask Nurit's Naomi's question, which was specifically about any plans for the programs to expand and to include fathers in grief and broader community education?
You meant the intervention we did at Desert? We're gonna do it twice a year. We need some money for that, but this is the plan. I mean, after we saw the pilot and it was so exciting and good, we're planning on doing it twice a year. And also, actually, once we did it once, and people will want to do it, and all the conversation about it is raising now. Men will feel different. Maybe they reach out for a therapy or for any interventions, or maybe group or something like that, but they will know that somebody sees them. So I think it's already happening those days.
Great. That's wonderful. And thank you so much.